Okay, so we're in a CNA lab today with mannequins, as you can see, on different beds. And this is what you should start expecting at our state conferences, is that you'll be set up in a place where you have access to mannequins and patients in beds and raising and lowering and that kind of thing. And so this is skill 5, giving a back rub for home health aid. And so as with any skill, I'm going to gather my materials. In this case, it's a lotion and a towel. I'm going to wash my hands, okay, and I can just verbalize that, or maybe the room will have hand sanitizer for you, depending on how that's set up. You wouldn't have to go through and do all the hand washing steps from before, unless it was a combined rubric where they say, okay, you're going to do the hand washing station and then move over to take care of this with your patient. So I would just put on my hand sanitizer, for example, and I'm going to come in the room and greet my patient. Hi, I'm Katie, and I'm your home health aide, and I'm here to give you a back rub today. Is that okay? And so I'm talking to my patient, because remember, on your rubric you're going to get points for good communication with your patient and all that kind of things there, that you did that. And then I'm going to try to maintain my patient's privacy. This patient here is a male, so he obviously doesn't have breast tissue here, but either way, I kind of want to maintain that privacy and that dignity. So, if I had a rolling sheet thing, I could move that. For him, I'm just going to keep this blanket up over him as I have him roll to his side. So can you just roll to your side for me, sir? And I'd have him roll, and I would just keep that blanket, man or woman, tucked up across the front of their chest so that they have that privacy there across the front. And then I'm going to take my towel, and I'm going to tuck it underneath of my patient here on their side, over that bedding, just so that I don't get any lotion onto the bed at all. So just tuck that underneath their side. And again, in real life, I'd make sure my bed railing was down. I'd make sure this was flat. Those aren't points on your rubric, but just so that if you're learning this skill, that's kind of how we would want to be set up. And then I would do all this massage here from this back side, but I'm going to move to the other side just so that you can see that I'm not in your way, so that you can learn how to do this a little bit better. So I'm going to go ahead and take this hand sanitizer, or this lotion, over here. And what I'm going to do with my patient on the side is I'm going to take a small amount of it and put it in my hands and then get it warm. Okay, so your hands are cold. The lotion's, room temperature, but it's going to feel cold against their back as they've been laying in bed. So go ahead and warm those up. And then I'm trying to promote circulation back up through the body. So I'm going to start low on their back and just run my hands all the way up toward the neck on either side, and then return along the side. So I'm making this circular motion up their spine to the neck and around on the sides. Okay, so it's a circular pattern. You're going to do that 3 or 4 times. And then we're going to, add more lotion as necessary. So throughout the skill, I might add some lotion, and again, warming it up. And then on step 9, it talks about doing a spiral motion. I think of it more as a swirling. And again, I'm going to do this swirling motion from the bottom up, again, trying to promote circulation, and then down along the sides. And so I'm just doing a swirling pattern with my hands, up and back down, up and back down. Your rubric talks about doing this for a total of 45 to 90 seconds. A lot of times we'll actually do this massage treatment for about 4 to 6 minutes for our patient. As I finish, I'm going to take my towel and just kind of get any excess lotion off of their back for them. Okay, and remove that. I'll reposition my patient back into bed, again maintaining privacy. Just rolled over there for me. At the end, I'll wash my hands with hand sanitizer, put any of my equipment, my lotion, back where it belongs. And then you're going to use a daily recording sheet. So you'll find this in the short sheet guidelines on the Montana HOSA website. You'll find this on the national guidelines. But there'll be an example. There's a sample one in there, and then there's an empty one where you would record anything that you did for your patient. And this would be included at the conference. You'd get this in there, and you kind of fill out that you gave your patient a back rub. You might notice any extra skin conditions or things that might be on there if they had a wound or an open sore, on that kind of thing. And then again, you get points for maintaining standard precautions and good communications with your patients. So don't forget to talk to them as you're verbalizing those steps for the judge. Don't forget that you still have a real patient here that needs to be talked to and communicated with. So that's skill 5, giving a back rub for home health aid.